It's now day 2 of the official lockdown in Lagos and the Federal Capital Territory in Nigeria, and COVID-19 cases continue to increase. As at today, it is now 139 cases spread across the 6 geopolitical zones.
All right, in Abuja, the Federal Capital Territory, major roads, airports and markets were on Tuesday deserted. How residents will fare during the lockdown is a source of concern due to various levels of preparedness by individuals and families.
Indeed, while critics continue to clamor for welfare of citizens during the 14 days lockdown, officials are keen on ensuring that Nigerians are safe from the ravaging coronavirus. Well, joining us now from our Abuja studios to discuss the matters arising during this coronavirus lockdown is Aondover Utsaha, a public affairs analyst and a resident in Abuja. Thank you so much for joining us, Mr. Utsaha, if you can hear me. The head of the Presidential Task Force yesterday,
thank you for having me.
The Secretary to the Government of the Federation, Boss Mustafa, said after day 1, appropriate restriction protocols and exemption guidelines are needed in the next 13 days. In your opinion, what should those protocols entail? And tell us, as a resident of Abuja, what have you noticed so far? What did you see coming this morning? What's the level of compliance?
Thank you very much. As at yesterday, the person who was in charge of compliance said about 85% was achieved in Abuja. And this morning, driving down from Kubwa to your station here, I observed that the compliance is really very high. I was particularly impressed because I encountered only a single checkpoint between Kubwa and here, but generally the roads were deserted. And it appears people have come up to realizing that what needs to be done very well. I commend Abuja residents for adhering strictly to the directives.
But a lot of the concerns are the fact that people are not social distancing. Take, for instance, when you see pictures coming out in the country, you'll see that to a large extent, a lot of people are on the roads, they're walking in very close proximity to one another. And also, the virus, it sounds very funny now, but the unsung virus that a lot of people have been looking at all this while, the virus of hunger, the HungVid-20, like some people will colloquially and jokingly call it, is beginning to raise its ugly head. Some parts of Lagos yesterday inundated with people on the street having protest about the fact that they had nothing to eat.
Well, if you ask me, although this statement may be belated, it is very clear, unfortunately, that we never planned for this. You know, sometimes it's unfortunate we try to be rather political about sensitive issues. I recall reading a story online where a minister in Rwanda was supposed to have been booted out of office because she gave wrong figures to the president on the preparedness of Rwanda. Now, there was this boastful carriage or giving the impression that Nigeria is ready. Clearly, we are not ready. We did not do enough to sensitize the people. We did not, ab initio, we did not do enough preventive measures. We would have been preventing more than curing. And take our minds back to recent statistics we got. Nigeria was supposed to be one of the poverty capitals in the world, because many people cannot earn up to the basic living wage, and most of the people earn on a daily basis. So when you have this kind of situation and you see what is coming ahead, it's attacked, it emanates from China, it's affecting Europe, it's going to the US, you prepare yourself here. There's an adage in Tivland that a leper or a crippled actually starts his journey at night, because he knows if he waits till the day, the able-bodied persons will overtake him and leave him behind. We did not start preparing on time. So it is really, really going to be very difficult. But I mean, it's all because we have this notion of saying it's better to be alive and to die. But you may actually run away from dying from coronavirus and die of hunger. We're not prepared, and we still are not prepared. I'll just say a single thing, then I will drop. In all of these activities going on, we keep hearing a particular abbreviation, NCDC, National Center for Disease Control. Indeed, much of what we are doing, I dare say 80–90% of what we are doing, is trying to control the disease. But what else are we doing? It's a serious challenge. We're not ready.
You have spoken about the fact that Nigeria is, in fact, the poverty capital of the world. And as my co-host Rufai rightfully mentioned earlier, we're seeing people beginning to come out to say that this 14-day lockdown doesn't benefit them. Now, how far-reaching should this federal government's relief be, the package, in reaching the low class and those that absolutely need it, especially in Abuja?
Two things I would say. One, as I speak to you, I listened to the Minister of Humanitarian Services yesterday, talked about plans on the ground to actually reach out to 11 million poor people and then increase the number by about 2.6 million. You're already in war and you're only preparing to go to war when you're already on the battlefield. You're failing already. That's what I alluded to earlier on. And then we have this one-way traffic of thinking along issues. What works somewhere may not necessarily work where you are. So you really need to domesticate whatever you adopt from elsewhere. Clamp down worked in China. Isolation worked, was supposed to work in Europe and America. It does not mean any of these two would necessarily work in Nigeria. You look at our peculiarities. I recall reading something, somebody was making a suggestion that we should have had an Afrocentric approach to this issue. Afrocentric because we have our own varying peculiarities. Our urban planning is crazy. Like Dikechukwu Merije mentioned yesterday, how are our homesteads built or developed? We stay in slums, we stay in bachelor settlements, face me, I face you. Naturally, our default way of existing is antisocial. Is socializing rather. We group together, you know. So this is what I would have thought. I mean, between yesterday and today, I was thinking, so what could be the Afrocentric approach to resolving these issues? Instead of clamping down on churches and mosques, instead of closing down schools immediately, what if you get statistics from these organizations? For instance, I belong to a church, and in the church, I belong to a subgroup. So my statistics and those of people within my locality are captured there. Perhaps if palliatives were going to be given to the community, it is easy to get the statistics from respective churches. The churches will now be looked at, and the mosque, like social organizations that give data and statistics on the people that belong there. And the next question would be, how about those who don't worship in churches and in mosques? Naturally, you look at them as the antisocial people who naturally have decided to self-isolate. You know, so I think we jumped the gun. We lost an opportunity in getting proper statistics. How are you sure that the 11 million are actually the poorest of the poor? How are you going to get the next 2.6 million? What's the criteria? I mean, this thing is affecting almost everybody. It's going to be very difficult. And then I add the last point before I submit. Like I said, what everybody is talking now is focused on NCDC, National Center for Disease Control. But a lot of other economies and societies are thinking, what happens after COVID-19? Clearly, we are isolating so that the window period of the virus would be lapsed and then we'll hopefully recover from it. But I tell you, our social setting and even office etiquettes will be completely affected by this scourge. How are we planning to ensure that when we get there, we'll navigate effectively? We need to be proactive. We are not being proactive.
Well, we are not proactive, yes, but we have gotten to this point now. I like the fact that you have also mentioned solutions to the lapses which you have identified. Is it too late to get those religious houses you talk about? Don't we have data and statistics for them? Can't we still reach them? You think it's something we cannot do? The school feeding program, the president mentioned that this will go on. And we've heard the Minister of Humanitarian Affairs say it will indeed go on, even beyond the 3 states down on lockdown. It will go on nationwide. Are you saying that we still cannot reach the people through these platforms? But let me also ask you, because you also rightfully mentioned why we must have a lockdown. It is an opportunity to curb that virus, is an opportunity to curb the spread of the virus. And so let me ask you specifically, what are your expectations as this lockdown continues for the next 13 days for the initial instance? But you will respond to these questions I have raised when we come back from this short break. Please do stay with us. We'll be right back. Welcome back to the Morning Show here on the Rise News. We still have Mr. Utsaha, Public Affairs Analyst and an Abuja resident in our Abuja studios, talking about the fallout from this lockdown, especially in the Federal Capital Territory. Thank you so much for staying with us. And before that break, I was asking, because you had mentioned that we had closed the stable doors after the horse bolted from the ban, when you said we closed the schools too early, we've closed the religious houses too early. And I asked, is it too late to get those statistics, those data from these bodies you have mentioned? And a follow-up to that, I was asking you, what are your expectations as we continue with this lockdown? I mean, health authorities need to ramp up on those exposed to infected people, contact tracing. Over 5,000 people need to be traced. What are your expectations for these 2 weeks?
Well, I would say half bread is better than none. I mean, we should have thought about the palliatives ab initio, like I mentioned. Yesterday morning, a friend told me that virtually all, if about 80 to 90% of the Okada riders in Abuja town and even in Lagos had fled the town at night, heading back up north. You know, I thought it was just some rumor until I saw it on the news that the governor of Kano, his convoy actually intercepted a truck full of persons who were coming in from Lagos and Abuja. And it's understandable. It's the survival instincts of the human being. Mindful that for the next 2 weeks, he will have no business to run in Abuja. He has to relocate to where there's no restriction. But then the question is he relocating clean? Could he be a weak link to spreading this virus from Abuja, Lagos to Kano? Only time can tell. But it is not too late. I think we can still, most of our religious organizations still have umbrella bodies. You could liaise with them, but would not be as effective as it should have been. And the whole idea behind this is palliatives shared under umbrella bodies are actually easier and more effective to reach down to the people if the statistics are correct and not falsified. But in this situation now, you are actually putting the cart before the horse, as it were. But I guess we just have to do something. Otherwise, those who run away from the virus may end up dying of hunger somewhere. And then it may get to a point where naturally people would revolt. Not because they want to oppose the directives of government, but because they really need to survive.
Right.
So what I would be expecting within this period is that we should actually go ahead and ensure that at least basic necessities of living, food should be available. Water, very important. Light for those who can afford. And like I heard the minister, one of the ministers yesterday talking about discussing with DSTV to give 1 month access to Nigerians. It's good, but I wish all of this was done even before they clamped down.
Okay.
You know, it's purely all about being reactive.
Okay.
Unfortunately.
A lot of people will say, how about the minister ensuring that there are a lot of jobs in the country? Because that's incidentally the Minister of State for Labour and Productivity. But I want to talk about the donations coming in. The PDP are pushed back as regards stats, you know, as regards even the donation coming in by saying that shouldn't we have an independent body of some sort to look at it? Because there have been words in circulation about even how the donations are being disbursed. You want to talk through that? What should be the fine measure? In fact, Dr. Aliyu, the leader of the Presidential COVID Task Force, as a coordinator, national coordinator, was talking in the lines of that this morning, that everything is certain as regards donation. But some people are saying we don't still trust what is happening as regards that donation.
You won't blame the people who don't trust how the resources garnered from the donations will be deployed. I don't completely blame them. We've had situations whereby even in the situation where you had internally displaced persons in respective states, some people made mincemeat out of the opportunities at the expense of those who were suffering in the IDP camps. During the flooding, it's something that is regrettably, unfortunately, with many of our people who are entrusted with public trust. So I was thinking this morning, if donations come in, can it be classified as income that has been generated to the government? If yes, Can it actually be spent without the National Assembly appropriating it? If yes, then maybe perhaps we should restrict our donations to actually components or set specific needs. For instance, there has been this clamor for respirators. We really need respirators now. So instead of giving me £1 billion, why don't you provide us, like what one of the banks did in Lagos, an isolation center, fully equipped. Nobody can actually pilfer from that. Why don't you provide the respirators? Let the NCDC come out with exactly what they need. Yes, some resources may be required, because I would expect that those who have volunteered, for instance, even though they are not coming in to make money, and even the medical practitioners who are putting their lives at stake and the lives of their families, they should be properly compensated, if not at least their lives insured. So this would be my thinking. I would rather people donate items that are required than donate monies.
Very quickly, as we wrap up, you have spoken about, these monies getting to the people that truly deserve them. And we've also spoken about the fact that, the data that we currently have might not be enough. The database, rather, that we have might not be enough to make sure that it gets to them. Now, is it not possible to use the BVNs? There was a time where there was a clamor for BVNs and nobody could receive any monies if they didn't have this. Shouldn't this be an avenue that the federal government should be looking at?
Absolutely. If it's for credit into individual customers' accounts, the BVN is key. No one person has more than one BVN. So if the government is intent on disbursing money into accounts of Nigerians to ameliorate the suffering, so to say, BVN is a very good window. But it doesn't stop at money. I read also yesterday that one of the markets in Lagos is planning to make themselves a mobile market, moving from street to street, more or less, selling things to people. So money in my account alone, I won't feed on money. I need to be able to have items that I will buy and survive as a family. So I think we need to be multitasking and multi-thinking at the same time. I would expect that not only the Secretary of Government of the Federation and the Minister of Health are working, all the other ministers too should be involved in things. You see, the Yorubas have an adage that several roads lead to the market. But I am of the opinion that even that single road leading to the market also leads elsewhere. It means there are pros and cons on whatever actions we take. So we need to be really proactive. There are no two ways about it.
Right, we'd like to say a very big thank you to you, Utsaha, and thank you so much for your time. And you too, stay safe, as we see a lot of other people out there should stay safe.